Hello, welcome again to my channel, the teacher channel. So the objective of this channel is to inform on issues concerning first aid. Okay, first aid is an emergency care which you give to somebody who is ill or injured. Of course, you know that the emergency can happen anytime, any day. Emergency is an unplanned incident that requires urgent action. Okay, so on this channel, my objective is to bring a series of topics concerning first aid as it relates to different types of emergencies. There are numerous, there are many types of emergencies that could happen. So you stand a very big advantage. You gain a lot by, coming to this channel, especially if you can subscribe. Okay, so if you can subscribe, that would be very much appreciated. And the reason why it is important to subscribe is so that you get a notification once I upload new video, which is gonna come on a regular basis. Okay, so you get an alert, you get a notification, tell you that there's a new video that you may want to watch. Okay, you can also like the video, you can share the video. It is very important. Okay, everybody needs to, know about some of these emergencies and how to respond to them should they happen. Today, my focus actually is on choking. Okay, choking is a fairly common emergency that can happen to anybody across age groups. Okay, we have 3 age groups. We have babies, we call them infants. We have children, we have adults. So choking is fairly common. Okay, so knowing what to do when somebody is choking is very important, and that is the objective of this particular video. Bear in mind that what to do may vary across areas, regions, continents. So what I'm teaching is actually what is obtainable in my location. Okay, so if what you need to do is different, so you are expected to adjust. Okay, so I have a choking tree. I just come up with this tree just to visualize what should be done. So to make it simpler to understand. So it's called choking tree. So this choking tree is my handwork. So it's going to be like a tree with the branches. So you can actually trace that tree. And then you have different stops, okay, indicating different phases or stages of choking, and then what to do. Okay, so that is what I. To start off, there are 2 types of choking. So this is my choking tree. So there are 2 types of choking. So this is called mild. The very first one is called mild. Okay, mild choking. And then the second type of choking is called severe choking, severe. Okay, severe, so those are two types of choking you have. So mild choking happens when there is, generally choking happens when there's a blockage in the airway. The airway is a passage. Of course, that passage starts from the nostrils and then ends at the lungs. So it's a passage. Okay, so through that passage, oxygen is inhaled and carbon dioxide is exhaled. So if there's a blockage on that passage, choking will happen. Whether the blockage is partial or total, so partial blockage of the airway will lead to mild choking. And how you know that somebody is mildly choking is if the person has a loud cough. Okay, usually there's a loud cough that follows this. Okay, so loud cough, so somebody will be able to make some sound, and the loud cough is always present. Okay, so remember that this is as a result of airway that is partially blocked. Okay, partially blocked airway will result to mild blocked air, where will lead to mild choking. Okay, so what do you do? What is the first aid when somebody is here? Somebody is eating or drinking, and then all of a sudden the person spontaneously begins to cough, showing that the person is mildly choking. So yes, you need to do some first aid. And what is the first aid here? You just encourage the person to keep on coughing. So that cough is important because you want to clear the airway, and that is what that cough is doing. So encouraging the person to keep on coughing, and at the same time, you also need to monitor the person's airway, breathing, and circulation, which is what we call ABC. Okay, airway, breathing, circulation. So while you're encouraging the person to keep on coughing, your eyes are on the person's ABC. Why are you doing that? Because somebody can actually move from here to the severe choking, which is what I'm going to describe soon. So by keeping your eyes on the ABC, you want to keep watch in case somebody is going from bad to worse. And of course, if that happens, it is going to reflect on the ABC of that person: airway, breathing, and circulation. So encourage the person to keep on coughing while you monitor the person's ABC. That is the first aid you do here. So whether it is a baby, or whether it is a child, or whether it is an adult, the same thing. Okay? Now that's all we have to say about mild choking. But let us come to severe choking, which is very serious. And severe choking happens when there is total blockage of the airway. So here the airway is totally blocked. The airway is totally blocked. Okay, so here is airway, the airway, that passage, air. So the airway is totally blocked, resulting in a severe. This will result in a severe choking. Okay, airway is totally blocked. Okay? So totally blocked. So when the airway is totally blocked, so in other words, if this is the airway, okay, this is the airway leading from the nostril through the mouth to the lungs, and then that airway is totally blocked. So what that means is oxygen is not good getting in, and of course, carbon dioxide is not leaving the body. So this is very dangerous, very, very dangerous, and is actually a life-threatening situation. It can actually lead to death within minutes. If not is done to relieve this choking, the person may likely die from that. Okay, so severe choking, and when somebody is severely choking, the person will not be able to make a meaningful sound. In fact, the person may not even talk. The person may not be able to cough. The person may not be able to make any meaningful sound. And that is how you know that it is really serious. And in most cases, there's a universal choking sign, and the person will just hold the throat. And so because the person will not be able to talk, so this is a way of announcing, this is a way of actually communicating to anybody who is around that, hey, I am choking, I'm in trouble here. I cannot talk. I would want to talk, but I'm not talking. I can't talk because of the airway that is totally blocked. Okay? So now, but initially, this person will be conscious because you still have some oxygen in circulation. So the person will stay, the oxygen in circulation will be enough to carry this person for some time. So resulting in consciousness. So the person is conscious. And another thing that can happen is unconsciousness, okay? So unconsciousness, as time goes on, the oxygen will be depleting. So the oxygen will be depleting until it gets to a point where it is no longer enough to carry the body. The brain will be deprived to a point where the person will go unconscious. Okay, so but initially, at the initial time, the person will be here. Okay, so now another decision you have to make is if this person is an infant, okay, or this person is a child or adult. Okay. All right. So this completes our tree now. Okay. So choking could be mild. We have already described this, or severe. And severe is serious kind of choking resulting from an airway that is totally blocked, okay? So initially, somebody could be here because there's still enough oxygen in circulation, so the person can still be conscious, all right? So now, is the person a baby? Yes, if the person is a baby who is consciously choking, okay, consciously and severely choking. So what you do, the first aid you do here is you grab that baby, let's assume this is the baby, okay, who is severely choking. Baby is not making any sound, but baby is still conscious. So take the baby and put on your elbow, and then make sure you support the neck, and then lower the head, and then with the heel of your hand, you give 5 back blows. 1, 2, 3, 4, 5. And then turn baby up, okay? Okay, face up, but head is slightly lower. Then use your 2 fingers. 1, 2, 3, 4, 5. So you keep on doing this as long as baby is conscious and the object does not go away, okay? as long as this baby is conscious and the object is still there. Okay, you keep on doing the 5 back blows and 5 chest thrusts. Okay, most likely in some cases, after the 5 back, the object can pop out. Or after this, the object can pop out and the baby will begin to breathe on his or her own. Okay. Otherwise, if after some series of 5 back blows followed by 5 chest thrusts, if that we're not able to dislodge the object or the substance responsible for the choking, the person will go unconscious. In this case, the baby will go unconscious. So what you do, you put baby on a hard surface like this, okay, and then you call 911 or your emergency number. Okay, you call 911 and then you start CPR on that baby. And of course, the other video, I told you that CPR comprises of 30 chest compressions followed by 2 breaths. But before you give 2 breaths, you need to check the mouth in case the object is coming out. And if you see the object clearly, you need to use your small finger and scoop it out. But don't do that blindly. If you don't see anything, don't attempt removing. But you can only attempt to give 2 breaths, okay? 30 chest compression, check the mouth, okay, before you give breath. All right, so now what if the person is a child or the person is adult? So if a child or adult, you use the same technique. So the person is severely choking and still conscious, and the person is a child or adult. So in this case, you do it slightly differently from what you did in the case of a baby. Baby, you carry baby on your elbow, okay, slightly lower. I showed you that. But in this case, because this adult is standing, or the child is standing and holding the throat like this. So what you do is, of course, you get permission, and then you'll be able to give 5 back blows. Okay, you give 5 back blows between the shoulder blades. And then you go at the person's back, okay, and look at the belly button move about 2 inches above the belly button. And then you do 5 abdominal thrust, okay, 5. So you repeat another 5 back blows, 5 abdominal thrust. So if this person is very huge, or maybe the person is pregnant, your hand cannot go around, you can actually do it on the chest here. Okay, so 5 back, 5 chest thrust in that case. So you keep on doing that until the object goes away and the person begins to breathe. Otherwise, as time goes on, the oxygen in the blood stream will be depleting, and of course, the person will go unconscious after some time. All right, so you do exactly what you did in the case of an infant. Okay, you lower this person gently on a flat, firm surface, call 911 or your local emergency number, and then you switch to CPR. Okay, 30 chest compressions, check the mouth before you give 2. So it's 30 and 2, 30 and 2. Okay, 30 and 2, So 30 and 2 breath. So 30 chest compression, then check the mouth. So if you see the object clearly, then scoop it out before you attempt to give 2 breaths. If you don't see any object, don't try removing. Just give 2 breaths and keep on doing that. Hopefully the EMS will arrive and take over, or the person may even start breathing on his own before EMS comes. So this is the choking 3, okay? So choking is either mild or severe, okay? Mild is as a result of partial blockage of the airway. Severe choking is as a result of total blockage of the airway, okay? So in that case, you have to likely state that somebody is still conscious or somebody is unconscious. If the person is unconscious, is still conscious, so you need to now ask yourself, is the person a baby? If the person is a baby, then grab that baby and put on your elbow, head slightly lower, and give 5 back blows between the shoulder blades. Okay, and then 5 chest thrusts. Okay, you keep on alternating. Hopefully the object will pop out and baby begins to breathe. Otherwise, the baby will go unconscious and you need to switch your technique. Call 911 and start CPR. Okay, if the person is a child or adult, okay, most likely the person is standing, holding the throat, okay? So in that case, get permission and then give 5 back blows between the shoulder blades and then 5 abdominal thrusts. Okay, make sure it is above the belly button. Okay, 5, 1, 2, 3, 4, 5. Or you can do it on the chest depending on the size. All right, okay. Hopefully the object will get away. Otherwise, the person will go unconscious. At that point, you lower the person on the hard surface, call 911 and start CPR. Okay, so this is how to handle choking emergency. And this is fairly common, okay? So mastering this technique is very important, very, very important, okay? Once again, please subscribe, like this video, share this video, subscribe. I have more important, very, very important topic to be treated. And so subscribing is very, very important so that you get notified once that is done. So thank you so much. And my next video is coming. See you then.